So simulation by itself is a tool that helps you advance the practice of what you're doing. In healthcare specifically, because it's so important to take care of patients, we can't really practice on patients. So we really want to learn in a safe environment, something that's called psychological safety, so that a learner can go through all the motions and all the steps and procedures, but without any harm, either to themselves or to the patient. USF Camels is sort of a shining star in the simulation world. But it also allows us to partner with other centers in the area and learn from each other. That's the beauty of simulation and the beauty that is Camels. We are experts, but we also link up and work collectively with other simulation centers and simulationists throughout the country and in local areas. So Sim Week helps us to reestablish our friendships, and get a little competition going, but also allows us to interact and share with people that we trust to make ourselves better. It's the little light bulb that goes off when a new practitioner is trying something new or has been doing something and gets that last little change. You go, wait a minute, I can do it differently. And at that aha moment, those are the moments that I live for, because if this center wasn't here, they would either miss that opportunity altogether, or perhaps they do something that could potentially harm a patient. But they're learning it here, they're learning how to get their skill set better, how to communicate within the team, and the little light bulbs that just go off and you go, oh, that's what I wanted to do, or I didn't know that was what I was doing, or how I could do it better. So every day, that's what keeps me coming back, is knowing that every day someone today at Campbell's is going to learn something that makes people better.